Alright, so I'm doing the IV piggyback medication administration. But in the last video, I do not have my primary bag or my primary tubing, so I'm just gonna try to deal with what I have. I would walk in, introduce myself. I would wash my hands, close the door behind me. I'm going to explain the procedure to the patient. I'm going to explain that we're giving Rocephin, and we would normally give that over 30 minutes. And then I would want to make sure whatever's infusing, and make sure that's compatible with what I'm giving. I would want to assess the IV insertion site, make sure there's no phlebitis, infiltration, inflammation, any redness, make sure there's no swelling or it's not hot. I would then also want to ask if they have any allergies to any medications that they know of. So I would have my primary bag, my primary solution, and I would want to choose the port that's furthest away from the patient. And I would go ahead and I would scrub that site or that port, and then I would connect my secondary tubing to that port, and then I would back prime it with the normal saline, and I would just lower that secondary bag, just make sure it's getting through there, and then I would fill my chamber up halfway or third way full. And then I'm going to go ahead and spike my my medication. And also before, I would want to make sure I add my label on my medication of the time that we administered it, the amount, the patient's name, the type of drug. So then I'm just going to go ahead and spike this. Okay. And then we want to make sure when we hang our bags that our primary bag is lower than our piggyback. So if this was my primary bag right here, I would make sure that my secondary bag is above. And then I would just squeeze my chamber and make sure that's filling up. And then I would unclamp my primary tubing and my secondary tubing so that way it could flow through. And if I had a pump, I would connect it to my pump and set my flow rate. So then I'm going to document using correct format, the date and time of the procedure, state the documents administration according to agency policy, and then document the IV solution that's infused, their intake and output according to your hospital's policy.